Hello, my name is Joy Wisdom, and I want to talk to you about emotional pain. And emotional pain is now being acknowledged as a painful process for some of us. I recognized this 20 years ago when I was working with babies and mothers and other people, how emotional pain was very much part of our painful experience. And in my Cranio Sacral Therapy training, I could find that pain, but it wasn't skeletal. And I could maneuver the body and the skeleton and put it in a new position, but actually the emotional pain remained. And finding solutions to that was part of my quest that I did in early 2000, looking for a lot of answers to why people didn't get better. So I wanted to show and share with you my experience from emotional pain and how we can use methods. And I've developed methods called Dissolve and Resolve Emotions, DARE for short, and it is a professional practitioner's training, CPD approved. So emotions cause pain, and of course we have the emotional vulnerabilities, the depression, the anxiety, and the stress that goes with it. We also have the emotional pain from the impact when we have skeletal issues, when we have falls or a car accident, whatever. The shock and trauma that is created at that time is also in the body as that memory. And those memories retain that emotion. And the emotions are then created as part of our makeup. And we'll go into more of that in a moment. Emotional pain is not common knowledge. And I found emotional pain in my quest looking at clients and working with newborns in early 2000. I kept finding this emotional pain. And it's been known about this phenomenon for some time. Studies go back to 1997, 2003, when Harvard University started to look at this, and we've had more in 2018 and 2021. And chronic pain is depressing, and likewise major depression may feel physically painful. Pain is wearing, and if you have joint pain, etc., there can be also emotional pain that goes with it. And this is where taking painkillers don't work. We can take the painkiller, but it actually doesn't help to remove the pain. And researchers learned more about how the brain works, how the nervous system interacts with other parts of the body. They discovered that pain shares biological mechanisms with anxiety and depression. It's a somatosensory experience that affects our nervous system and affects the neurotransmitters around the body. Psychosomato experience that won't show up on an x-ray. As I said, painkillers won't be effective, but we still got that pain. And of course, through time, around irritable bowel syndrome, etc., it's been seen as an emotional or stress level affecting the physical body. So a psychosomato effect as our body responds to emotion, and then biologically is then being changed, transformed within, so that we live with different system impacts and affecting us on many levels, as well as physically, emotionally, with tiredness, fatigue. The ripple effect is huge. Certainly from my experience, emotional pain moves around. Clients could come along and say, oh, I've got this awful pain here around my shoulder and neck. And yes, you can release the muscles, you can realign those very strong muscles in the neck and going down into the back. You can release many levels of that and help to relax the strain in the body. However, the pain may move further down the back because, from my findings, we do store an awful lot of emotions in the back area. And of course, the different layers of muscles that take on that strain and holding the body together. The spine itself is very much affected by emotional pain. And of course, we can have bones and joints that wear out. There is wear and tear on the physical body. And of course, when we have that wear and tear, it changes our structure and our how we stand, different pressures on the body. If we have pain at the knee or the hip joint, then we change position of how we stand, and our posture changes accordingly, which then gives more pressure on other joints and other muscles within the physical body, in the trunk. And of course, things like being pregnant, we have huge change in posture with all this weight at the front, and a lot of women suffer from different types of pain and joint pain after pregnancy because of the extra weight that we have carried, and very often suffer lower back pain, sciatica, etc. And of course, again, the inflammation that is caused by emotions and stress levels. We know that stress hormones create inflammation within the body, and of course we can then go on to suffer fibromyalgia, and that's just one cause. Arthritis is inflammation in the body, etc. And we do tend to have an awful lot of joint issues. We can also have those joint issues from reduction in hormones, in estrogen, progesterone, etc. And women can find that they have levels of lack of support, lack of calcium, but also the readiness of the body being able to assimilate minerals, vitamins, and the back office that works by supporting different functions such as calcium to get it around the body, etc. Again, hormones involved with the parathyroid that is involved in the secretion of calcium. So it's not just the bones. We need to look at the whole effect here for that person and what's going on for them. The bones may be the result of, but the cause can be many strings to the bow. Everyone experiences pain at some point, but in people with depression or anxiety, pain can become particularly intense and hard to treat. People suffering from depression, for example, tend to experience more severe and long-lasting pain than other people. The overlap of anxiety, depression and pain is particularly evident in chronic and sometimes disabling pain syndromes such as fibromyalgia, IBS, lower back pain, headaches and nerve pain. For example, about 2/3 of patients with irritable bowel syndrome who are referred or follow-up care have symptoms of psychological distress, most often anxiety. And about 65% of patients seeking help for depression also report at least one type of pain symptom. Psychiatric disorders not only contribute to pain intensity, but also an increased risk of disability. And this was my finding a long time ago, and why I wanted to find the reasons for people's pain and why people can recover and why people can't. And in my quest for more finds, I found that emotions were at the core of the issue, and emotions affects the biological functions, as we talked about, the stress hormones, that then affects inflammation within the body. That is going to upset the biological systems of the body, and it's not just one thing, it will have a domino effect on the individual. Why I believe integrated body, mind, emotion care is required to work with the individual and not the label. Somebody can have IBS, but that IBS is the result of, and the cause of it is way back here. And looking at the anxiety, reducing that anxiety and stress release from the person can then help the biochemical internal state and reduce that psychosomato effect, reducing the inflammation, reducing the stress hormones, and then allowing the body to start to heal itself from the internal side and the internal state. Giving the right conditions, the body can help to heal itself. And with dissolve and resolve emotions methods, we help that process to move along, and helping on a skeletal level, but also an emotional and biological level. I advocate various psychological and emotional issues come from what formation? From the womb, the transference, the transgenerational genetic conditioning, and actually we take on board these different areas of internal change or transformation we weren't meant to have, but we live with. And of course, things get passed down through the generations because of weakness or dominance, and it actually gives answers to physical disorders and the growing numbers of mental health issues that we find within society today. And DARE therapy is championing new solutions to mental and emotional issues. It's a revolutionary combination therapy, and it deals with present day and transgeneration historical factors, and of course the reincarnation is around the transgenerational of where it keeps coming back from way back where it can be grandparents issues, and obviously affecting us at a gut issue, a self-esteem issue. It's not just physical, it is also behavior and character that is passed down, the fears, the irrational fears, etc., that we can be living from. It's not ours, but we live it anyway. And this was proved through the Holocaust survivors and how their anxiety, stress, and irrational fears were passed down to grandchildren, and the children lived the irrational fears from their grandparents' horrors that they lived, and how they could then be affected, jumping generations, and sometimes it does that. So parents may not take it on board, but grandparents and grandchildren and great-grandchildren may be living from what happened to their grandparents and beyond. What we do today has an impact on our future lives, as our past lives have an impact upon us today, our present life. And this again is transgenerational. We are the creation of our past, present and future, and as I mentioned, we can be living from a mix of other dominance or weakness from what our grandparents did, even down to the smoking and drinking that they did, that is going to affect our fertility, our heart, cardiovascular issues, also our choices. Are we going to be able to choose things with positivity, or do we live in negativity with little choice? And again, this can come from past generations who didn't have choice. It's a fascinating area to explore, because these things do go on whether we believe them or not, and they do influence us at a core level and in our day-to-day living, even down to what our choice of food is, or our levels of proneness to cancer, etc. It depends what's going on in the history of the lineage and culture, what we're going to be more prone to. We may all look the same on the outside. Which one is suffering from emotional pain, anxiety, depression, unexplained pain? We are all different internally. We function differently. Our systems work on different parameters. We may all have systems. We may all have a nervous system and a brain. But how is it working for you? How is your subconscious working? How is your emotions affecting you today from something that may have happened adversely in your childhood. Having worked with some cancer patients that were fatally ill, and having the opportunity to be able to work with them, I found that each one of this small group that I worked with, each had experienced domestic abuse, and that was either observing it or being part of it. And each one of them had cancer, which I find is very revealing. How we treat one another, what we see, that adverse experience is going to have a big impact upon us physically, emotionally, mentally, biologically. And these people were in their 30s, 40s and 50s, but the experiences earlier on had set the parameters. And this isn't new information. The adverse childhood experience has been proved over and over again, how it affects us biologically with inflammation, the stress, the emotions that keep churning out the hormones, and the stress that declines internally. And it is linked with arthritis, it is linked with cancer, it is linked with strokes and heart attacks, it is linked to future early disorders that will come our way. And from my perspective, we need to be working and clearing this emotional pain, slowing down the cause of the inflammation, and taking turmeric or other types of minerals, etc., is helpful as a maintenance, but it won't deal with this level of devastation or trauma that people live, and will go on to have reduced lifespan. Disappointments from psychological agreements with the self also takes part in this anxiety and biological outcomes. The decrees with the self, the promises, the vows, the independence, the defensiveness, the disassociation with life. We can be drowning with our emotions, trying to cope with life, but being disappointed also creates emotions. It also creates a level of hopelessness and helplessness that actually goes on to affect the heart and how we are acknowledged, how we are part of the world. If we start to live with this loneliness, hopelessness, etc., we can also be affecting the heart support, the physical heart support that breaks down. And of course, those decrees and agreements with the self. I promise myself I will do X, Y, and Z, or somebody you are expecting to fulfill a promise from them and then they don't do it. It is a punch to the heart. We do feel that punch bag many times a day from the disappointments, our expectations of what we could have been living or enjoyed from a relationship, for instance. But it's also around the relationship with the self. Are we seeing life with rose-colored glasses and being very disappointed and saddened, grief underlying here from that lack of achievement? So how pleasant the day when we give up disappointment and striving for perfection. Some of the things that I teach is also about conscious communication, but also about the demands of perfectionism and independence, and how we can be very much stuck in a rut from these goals that we keep presenting to ourselves, or the mind keeps presenting. And life is full of disappointments because the mind isn't ever approving of what we have achieved. More levels to bring about before the mind would be happy and giving you any peace. And perfectionism is a big issue within our society, and it does create discord, it creates defensiveness and intolerance, and actually it can be quite distressing to live with somebody who is very involved in perfectionism. And we can make those changes. We can start creating new positive habits and thinking without sacrifice or mental health issues that actually come along with disappointment and perfectionism, independence, etc., of where we push people away without realizing. Check out the website for more. Marilyn Grenville said in 2020, "It's a mistake just to treat symptoms. You are not just a group of body parts. Everything works together. When one system is thrown out of balance, other systems can and will be affected. Conventional medical approach departmentalizes the different parts of the body, and patients will see a different specialist for each one. One of the main reasons why conventional medicine is not effective in the long term. And we're not separate bits, we are whole people whose bits interact constantly. And if you were suffering from headaches and digestive problems, probably see 2 different specialists. And there may only be one cause for the problems, but because they are treated separately, much less chance that the cause will be uncovered." And I couldn't agree more with Ms. Grenville's statement. It's a mistake just to treat the symptoms, and symptoms are the result of and not the cause in many situations. Cause is hidden from view, undetected by the observer and individual, and dissolve and resolve emotions looks beyond the symptoms presented, deals with core issues, and only need one body, mind, emotion specialist to treat. We are a mix of life and birth results, scenarios, shock and adverse trauma that knocks us out of kilter, sometimes for life. To find out, visit our website and check out. Memories and subconscious create stuck levels, which means living ancient baselines dominant within emotions and mindset. And DARE Ultra methods help to dissolve emotional traits, helping to rewire the subconscious mind. And innovation starts with us. My life didn't please me, so I created my life, says Coco Chanel. If you don't like what you live or the components in it, then make change to what you do want in life. Learn how to bring more innovation, empowerment and inspiration into your life with Joy Wisdom training, Zest of Life programs, and specialist body, mind, emotion, one-to-one mentoring and group New Era innovation skills and personal development plan. It's time to ditch it and don't live it. Improve communication, perfectionism, OCD and mental health issues, and learn more about how you tick, and inherited generational trauma, and deep dives into what is influencing underlying daily, and big packages exist. Do book a free Horizon call, find out more. And we all have a past, and the challenge is what we did in it. Not many of us have enjoyed the golden positive route of life, hence continue the traits lived long ago. Our quantum field takes it, chucks it back to relive, and we keep feeding. Personal development training, workshops and one-to-one mentoring and therapy help you to understand what's going on for you, and it gives personal plus professional development. And read more about my journey around the quest and finding the cause and effect of mind, body, health and historical intergenerational influences. You can buy the book online or through Amazon, and it is also in ebook. Books, downloads, and there are introduction to the books, so you can claim those free downloads as well. Emotional pain, you don't have to live with it. Things can change, and it is the integrated body, mind, emotion approach that gives you answers, solutions and a better life, giving you longevity, teaching you skills to be able to not go down that route again. My name is Joy Wisdom, and I have enjoyed talking to you today. I hope you have learnt and taken on board some of the hidden factors that may be affecting you and your pain today. Pain is wearing, and I would love you to live without it. There are ways, there are other solutions than painkillers. So please contact for more information and one-to-one help, or train as a practitioner. Develop different skills and understanding for you. There's a lot to choose from. Check it out on the website www.allonus.co.uk. Thank you for listening.